Okay, so today I'm going to talk about the nervous system. First, I'm going to start off with the common medical vocabulary for the nervous system. The first one is encephalitis. Encephalitis is inflammation of the brain. The combining terms are encephala, which means brain, and itis, which means inflammation. The next one is neurosis. Neurosis is a non-psychotic mental illness that triggers feelings of distress and impairs normal behavior. The combining terms are neuro, which means nerve, and osis, which means abnormal condition. The next one is neuroblastoma. Neuroblastoma is a malignant tumor composed mainly of cells that resemble neuroblasts. These occur in infants and children. The combining terms are neuro, which is nerve, blast, which is embryonic cell, and oma, that is tumor. The next word is paralysis. Paralysis is loss of muscle function, loss of sensation, or both as a result of a spinal cord injury. Para means near, beside, beyond. Lysis means separation, destruction, loosening. Psychosis is a mental disorder by loss of contact with reality, often with delusions. Psycho means brain. Osis means abnormal condition, increase. Aplasia is failure to develop. A means without, not. Plasia means formation, growth. Myalgia is pain of the spinal cord or its membranes. Myelo is bone marrow or spinal cord, and alegia is pain. Epilepsy is a seizure disorder. Epi is above, upon, and lepsy is seizure. Dysphagia is difficulty speaking or impairment in the production of speech. Dys is bad, painful, difficult. Phasia is speech. Hemiparesis is paralysis of one half of the body, right or left half. Hemi is one half, paresis is partial paralysis. Okay, now we're going to talk about the diagnostic procedures of the nervous system. The first one is spinal tap or lumbar puncture. A lumbar puncture is performed in your lower back in the lumbar region. During a lumbar puncture, a needle is inserted between two lumbar bones to remove a sample of cerebrospinal fluid. This is the fluid that surrounds your brain and spinal cord to protect them from injury. And this is kind of what it looks like. So what does a spinal tap diagnose? A lumbar puncture can help diagnose serious infections such as meningitis, myelitis, and encephalitis. Other disorders of the central nervous system such as Guillain-Barré syndrome and multiple sclerosis, or bleeding and cancers of the brain or spinal cord. Sometimes doctors use lumbar puncture to inject anesthetic medications or chemotherapy drugs. Okay, so the next one is brain biopsy. A brain biopsy is the removal of a small piece of brain tissue for the diagnostic of abnormalities of the brain. By examining the tissue sample under a microscope, the biopsy sample provides information about the appropriate diagnosis and treatment. And this is kind of what they do to do a brain biopsy. What does a brain biopsy diagnose? The purpose of a brain biopsy is to diagnose an abnormality seen on an MRI or CT scan by taking a sample of the cells from the suspicious area. There are generally two kinds of biopsies: open biopsies and stereotactic needle biopsies. The tissue cells taken during the biopsy can show what kind of brain lesions, abscess, tumor is present, and whether it's benign, which is non-cancerous, or malignant, which is cancerous. Electroencephalogram, EEG. An electroencephalogram is a test that detects electrical activity in your brain using small metal discs called electrodes that are attached to your skull. Your brain cells communicate via electrical impulses and are active all the time, even when you're asleep. This activity shows up as wavy lines on a recording. So you can see how they show up as wavy lines, and then this is what it looks like. So what does an electroencephalogram diagnose? An EEG is one of the main diagnostic tests for epilepsy. An EEG can also play a role in diagnosing other brain disorders such as brain tumors, brain damage from the head injury, brain dysfunction that can have a variety of causes, encephalopathy, which is inflammation of the brain, and encephalitis, which is stroke and sleep disorders. It also might be used to confirm brain death in someone in a persistent coma. A continuous EEG is used to help find the right level of anesthesia for someone in a medically induced coma. Okay, so now we're going to talk about the cerebral angiography. Cerebral angiography is a procedure that uses special dye, contrast material, and x-rays to see how blood flows through the brain. Complications may include allergic reaction to the contrast dye, blood clot or bleeding where the catheter is inserted. This could partly block blood flow to the leg. It can also cause damage to an artery or wall from the catheter. This can block blood flow and cause a stroke. And it can also cause damage to the kidneys from the IV contrast. So what does a cerebral angiography diagnose? It diagnoses abnormal blood vessels in the brain. It diagnoses bulging blood vessel in the brain, narrowing of the arteries in the brain, inflammation of the blood vessels in the brain. It looks at blood flow to a tumor, evaluates the arteries of the head and neck before surgery, and finds a clot that may have caused a stroke. Now we're going to talk about functional neuroimaging. Functional neuroimaging are methods that use to detect structural abnormalities in the central nervous system and localized brain neural activity in response to performing specific sensory, motor, and cognitive tasks. The two methods are MRI and PET. Magnetic resonance imaging, MRI. Magnetic resonance imaging is a medical imaging technique that uses a medical field and computer-generated radio waves to create detailed images of the organs and tissues in your body. MRI is the most frequently used imaging of the brain and spinal cord. It's often performed to help diagnose aneurysms of cerebral vessels, disorders of the eye and inner ear, multiple sclerosis, spinal cord disorders, stroke, tumors, and brain injury from trauma. The second type of neuroimaging is positron emission tomography, PET. A positron emission tomography scan is a type of imaging test that shows how organs and tissues are working. It issues a radioactive substance called the tracer to look for disease in the body. PET scans can check brain function, identify the source of epilepsy in the brain, show areas in which there is poor blood flow to the heart, determine if a mass in your lung is cancerous or harmless, and determines how far cancer has spread and how treatment is working. This is what the MRI and PET scans look. This is what a CT scan looks. This is what a PET scan looks. Okay, the next diagnostic procedure is an ultrasound. An ultrasound can identify nerve tumors and whether injured nerves are severed after injury. This is accurate in the diagnosis seen in hereditary and inflammatory neuropathies. High-resolution ultrasound is useful for imaging the peripheral nervous system. Nerve conduction studies. Nerve conduction studies give doctors information about how well and how fast the nerves in your body send waves of electrical impulses. This test can be used to check for various different types of problems with the peripheral nervous system. Okay, so what does a nerve conduction study diagnose? A nerve conduction study assesses nerve damage following an injury, checks for damage to the nerves, checks for conditions such as diabetes, checks for peripheral neuropathy, tests for conditions affecting the nervous system, e.g. Guillain-Barré syndrome, and checks for trapped nerves in conditions such as carpal tunnel syndrome or carpal tunnel. This is what the nerve conduction study looks like. Okay, so now we're going to talk about the nervous system abbreviations. The first one is ALS, amyotrophic lateral sclerosis. ALS is a progressive disease that affects the nerve cells in the brain and spinal cord. It causes the cells to break down and die. ALS affects muscle movement, talking, eating, and breathing. ALS is fatal and there is no cure. The next one is CNS, central nervous system. The CNS receives information from peripheral nerves and tells the body how to respond. The CNS is composed of brain and spinal cord. The CNS consists of relay neurons, interneurons. And this is the central nervous system right here. There's the brain and then the spinal cord. The next one is PNS, peripheral nervous system. The PNS functions as the pathways of communication between the CNS, central nervous system, and the rest of the body. The PNS is composed of cranial nerves, spinal nerves, peripheral nerves. The PNS contains sensory neurons and motor neurons. And this is an image of the PNS right here. The next one is CFS, cerebrospinal fluid. CFS is fluid that flows around the brain and the spinal cord. It flows between the two layers of meninges, which are protective tissues that protect the brain and spinal cord, made by tissue called choroid plexus, hollow spaces in the brain. And then there's the cerebrospinal fluid that surrounds the brain. The next one is CVA, cerebrovascular accident. A CVA is more commonly known as a stroke. A CVA is a sudden death of brain cells due to blood flow to the brain being impaired by a blockage or a cerebral artery rupture. And this is what a cerebrovascular accident looks like. Okay, so the next one we're going to talk about is CVA, coastal vertebral angle. CVA refers to the 90-degree angle that is formed by the bottom of your rib cage and spine. Pain in the CVA area is most commonly due to kidney infections. Right here is the coastal vertebral angle. This is where it meets the kidney and the spine, and you can see the angle right there. The next one is CVD, cerebrovascular disease. CVD is a group of conditions that affect the blood vessels and the flow of the blood to the brain. The next one is lumbar puncture. LP, aka spinal tap, refers to a procedure that involves using a needle to extract cerebrospinal fluid. Here you can see what that looks like, and we talked about that before in the other slides. Okay, the next one we're going to talk about is an EEG, an electroencephalogram. An electroencephalogram is a test used to record and see brain activity produced by an electroencephalography. So the next one is an EEG. It's an electroencephalography. An EEG is a procedure that measures electrical activity in the brain. Here you can see what it looks like, and here you can see what the reading actually looks like. MS. MS is multiple sclerosis. MS is a disabling disease in which the immune system attacks the myelin sheath, which results in communication errors within the nervous system. You can see what multiple sclerosis looks like. This is a healthy neuron, and then this is a nerve affected by MS. Okay, so the last thing that we're going to talk about is common medical and surgical procedures. The first one is deep brain stimulation. This is where electrodes are placed on the thalamus and it delivers electrical pulses to block the impulses that causes tremors. Primarily used to provide relief to patients experiencing tremors. Deep brain stimulation, this is what it looks like. DBS consists of placing electrodes on the brain, and it's a device is placed under the skin and the chest that delivers the electrical pulses. Craniotomy. This may be performed for many reasons, such as clipping, repairing of the aneurysm, repairing skull fractures, treating epilepsy, or relieving intracranial pressure. Craniotomies involve surgically removing a portion of the skull to expose the brain. Once finished, the skull flap will be replaced. This is a photo of what a craniotomy looks like. Craniectomy. Craniectomies work similar to craniotomy, except the portion of the skull removed is permanently removed or replaced later on, during a second surgical procedure. Next thing is aneurysm clearing. This often requires craniotomies to open up the skull. It involves clamping either side of the aneurysm to prevent it from rupturing by blocking the artery from receiving blood flow. Ventriculoperitoneal shunt is primarily used to treat hydrocephalus. It involves placing a shunt inside of one of the brain's ventricles to divert cerebrospinal fluid and restore normal flow of CSF. A small incision will be made, then a hole will be drilled into the skull. A catheter will be placed into the skull in a ventricle to drain fluid. The other end of the catheter will be placed subcutaneously and will drain fluid into the peritoneal cavity to be absorbed by the body. Here's a diagram of what that looks like. Okay, so for medications, they can be prescribed. It just depends on the diagnosis. For example, anticonvulsants treat epilepsy, and corticosteroids can be used to reduce inflammation that may be causing encephalitis. And then the sources for all the information. This is the first slide. This is the second one, third one, fourth one, fifth one, and then the last one. And that's it for the nervous system.